This is Counsel Club. I'm Dr. Ina, and we're talking anxiety. So what is anxiety? Anxiety is an emotion that's characterized by feelings of tension, worrisome thoughts, and even physical changes like your heart beating fast, sweating, trembling. It's important to make the distinction. The feeling of anxiety and having an anxiety disorder are related, but they're very, very different things. So let's first just kind of break down the difference. The feeling of anxiety is natural. It's an emotional response to stress or a perceived threat. It is a normal part of life and can be experienced by anybody in any situation. Feeling anxious is also temporary, and the feeling of anxiety should subside once the stressor or the threat is removed. Feeling anxious is also situational, so it could be specific to a situation like a test or a job interview or, being scared about public speaking. Feeling anxious should also be mild to moderate in intensity. It might be uncomfortable, but it should be pretty manageable and not really impact your daily functioning. The feeling of anxiety also serves an adaptive function. It can be useful to alert us if there's danger or motivating us to take action. For example, feeling anxious about a test might encourage you to study more. So an example might be, if I've got a huge presentation coming up at work, I might feel butterflies in my stomach, my heart might start beating fast, and I might have a lot of worrisome thoughts that I might make a mistake. But once that presentation is over, my anxiety will subside and I'm going to return to my normal self. Anxiety disorders are different. So by definition, an anxiety disorder is a mental health condition. Now with this, you're going to have excessive, persistent, and often irrational fear or worry. It goes well beyond the normal feelings of anxiety and can really impact your daily life. It's also going to be chronic and persistent, right? So this is ongoing, excessive anxiety. This can last for weeks, months, years, regardless of the situation or trigger. The anxiety can often be intense enough to interfere with your daily life, so your relationships, your work, and just the quality of your living overall. The physical symptoms with an anxiety disorder are going to be much more intense than just the normal feeling of anxiety. Maybe headaches, muscle tension, insomnia, gastrointestinal issues, all of those. The other thing is irrational fears. So with an anxiety disorder, the worry is disproportionate to the actual threat, and there actually might not even need to be a threat when an anxiety disorder is present. So there are different types of anxiety disorders. There's what we call generalized anxiety disorder. This is just excessive worry about any and everything. It's a moving target. It can be your health, your work, your social interactions, and it's occurring for more than 6 months. Then we have something called panic disorder, right? This is recurrent panic attacks, intense periods of fear, discomfort, with a lot of physical discomfort. There's social anxiety disorder, where the fear is focused on social situations, where someone might be judged, embarrassed, or scrutinized. And then we have a whole host of specific phobias, things like being afraid of heights, afraid of animals, afraid of flying, that lead to avoidant behavior. Another common term that gets thrown around is OCD, right? OCD, this is where you have unwanted thoughts, which are your obsessions, paired with repeated behaviors or compulsions to perform actions to reduce your anxiety. So an example would be, if I have generalized anxiety disorder, I'm going to be constantly worried about everything, right? My job, my health, my finances, my relationship. It doesn't matter. I'm going to worry about everything, and I'm not going to be able to control that worry. Because I can't control that worry, I'm going to start to see impacts in my sleep, in my personal relationships. And despite me knowing, I might know that my worries are irrational, it's not going to help. And I'm going to be unable to break that cycle without professional help. So some of the key differences are, feeling anxious is normal, it is temporary, and it is situation specific. An anxiety disorder is chronic, persistent, and has nothing to do with a specific situation. It can happen anytime. Feeling anxious is really not going to just impact my daily life, but an anxiety disorder is going to have significant impairment on my relationships, my life, and really my ability to function. Just feeling anxious should be mild to moderate and is usually rational, right? I'm gonna be able to say, I am anxious because, I'm giving this speech, right? Versus having an anxiety disorder where I can't really pinpoint it. And then with the physical symptoms, mild for feeling anxious, but often more severe for anxiety disorders. So what do, right? Let's talk about help seeking. If you're feeling anxious, being able to manage just mild anxiety, these could just be something like stress reduction techniques, exercise, relaxation methods, or even talking to friends or family. Anxiety disorders typically are going to need professional intervention from a therapist or maybe even a psychiatrist for medication. Lifestyle changes and other therapeutic approaches like cognitive behavioral therapy can be useful. So it's important to understand the difference so you can know when it's time to seek professional support for anxiety that's going beyond just the normal stress. With that context in mind, let's just talk a little bit about what the feeling of anxiety, not anxiety disorder, but the feeling of anxiety might be trying to tell us. Even though feeling anxious can be really uncomfortable, it can actually be really helpful in a lot of ways. So the first is being alert and being prepared. Being anxious kind of heightens our awareness of potential threats that are in our environment and makes us prepared to deal with them. This is useful. If you're in a dangerous situation, you're going to want to have a little bit of anxiety to help you navigate and sort of rally yourself to protect yourself. Feeling anxious can also be really good for motivation. If you've got a test or something important coming up and you have zero anxiety, are you going to study? Probably not. But just the right amount can motivate you to study a little bit harder. Problem solving. When we're feeling slightly anxious, we can actually be more creative and more productive. It encourages us to consider different solutions and kind of just be proactive when addressing issues. Another one is performance enhancement. In moderate amounts, feeling anxious can actually help you be more focused. So athletes, performers, and speakers often talk about this perfect level of anxiety that helps them with their concentration and performance. Emotional insight. Feeling anxious can serve as a signal that there's something in our life happening that needs to change, right? It's a clue. There's something happening, whether it's in relationship or personal, that it's just not sitting right with us. And this can lead to personal growth, which is what we're all kind of striving for, right? We develop these coping strategies, resilience, and we just become better equipped to handle future stressors. So we can also learn a lot about our personal values and priorities, right? The things that we feel anxious about can reveal the things we really care about. And if we're always striving to have this insight and know ourselves better, it's important to not just try to make this feeling of anxiety go away, right? Dig into it, explore it. It can help us recognize that there are unresolved problems or conflicts. If you get anxious every time you return to your childhood home, and then you feel better once you leave, that might be a signal that there are some unresolved issues, from your childhood that you might want to talk to someone about. It can also help us recognize our limits and our boundaries. Am I pushing myself too much? Do I need to be in this place? Do I need to take on this extra work? So overall, physical symptoms of anxiety, like when your heart starts beating faster or you feel tense or under stress, can also be an indication that we need to focus on our health, right? Our health, our lifestyle choices. What are we eating? How are we exercising? How are we caring for ourselves? So by paying attention to when and where we feel anxious, we can identify triggers and patterns. And once we have those triggers and patterns, we can start to think about, well, how am I going to deal with this? What are the coping strategies? Feeling anxious can teach us a lot about our coping mechanisms. It can help show us what strategies are going to help us feel less anxious, what's effective, what's not effective, and develop better ways to manage stress. So yes, anxiety can be beneficial in these ways, the feeling of anxiety, but it's important to manage it so it does not become overwhelming and start to impact your well-being. So if we learn to listen to and understand our anxiety, we can use it as a tool to make informed decisions, improve our mental and physical health, and enhance our overall well-being.